We are continuing our coverage of the closure of the Providence Sacred Heart Inpatient Adolescents Psychiatry Unit happening tomorrow.
Yeah, this comes as workers and members of the Washington Nurses Association held a protest this week against that closure. Connor McAvoy has more now.
The closure of the resource is something that's causing a bit of tension between the union as well as Providence. And the big question is where people should go as far as getting the resources needed with the closure happening tomorrow. And I managed to speak with the director of Inland Northwest Behavioral Health, who tells me that those people seeking those resources shouldn't worry. Providence released a statement saying the closure of the unit would not allow them to service 8 patients, a change from 22 patients from what they say was a decreased need due to outpatient programs. Those still needing inpatient care are recommended by Providence to go to local care options such as Inland Northwest Behavioral Health.
Up to 27 on any given unit, so we can swing beds back and forth. So 27 kids in case we have to block rooms for whatever reason.
Medical Director Dr. Douglas Hall says the closure is something the mental health clinic can handle.
I can't speak to nursing because that's outside my realm, but I can tell you I've got 2 practitioners. One's a full-time psychiatrist, one's a full-time psychiatric mental health nurse practitioner that I've assigned to that unit, so they can easily handle 25 patients between the 2 of them.
Staff of Sacred Heart and members of the Washington Nurses Association held a protest against the closure this week, worrying about the patients that'll have to make the adjustment.
They were concerned about where the patients would go, particularly patients that have other medical conditions.
Ruth Schubert with the Washington Nurses Association says the care offered at Sacred Heart for those patients was unique compared to what other services provide.
Who are autistic or have developmental delays or have ongoing conditions like diabetes that Northwest Behavioral Health simply can't provide care for.
Hall wants to set the record straight.
We can take diabetic patients, we can take patients that have all kinds of different medical issues, asthma, etc. We have our own internal medical staff that can handle a lot of different medical issues.
Hall isn't worried about taking the patients, saying in his years at the clinic, the capacity doesn't exceed what they're capable of taking.
We've got plenty of beds available. We've never maxed out our capabilities on our adolescent unit. It's always been below.
I reached out to the Department of Health for more data when it comes to inpatient care here in Spokane, but have not heard back as of news time. Hall wants to reiterate that people who are worried about getting those resources again, they're encouraged to reach out to Inland Northwest Behavioral Health. In Spokane, Connor McAvoy, KREM 2 News.